So the first aspect, the first part is the comprehensive school health framework. This framework is a holistic approach to build healthy school communities. It is internationally known, and hopefully you've heard of it already. It's really a framework that try to implement good health strategy in school, and that includes physical health, nutrition, sexual health, and also substance use. So what is special with this framework is that we have to think about it through across 4 interrelated components that really play together. And instead of looking at them separately, we should look at them as interacting with each other. So the first one is teaching and learning. Here, we really think about every curricula, every courses, every lessons, formal or informal, that are in place. So yes, teaching about substances and their potential harms, explaining how it works, what it does to your body is really important. We also think here about professional development courses for staff member. We think about informal learning from peer to peer, staff to peer, really everything that has to do with learning new knowledge falls under that aspect here. Then we have policies. Again, policies, formal or informal, at multiple levels, the rules that are in place, the guidelines that are in place in the school, in the classroom even, in the school district, at the government level. So really all the policies you may think, all the rules, all the guidelines that are in place fall under the policies. They are important, but they are not the only thing that we have to focus on. Next, we have social and built environment. Here, for the social aspect, we think about having safe space, being respectful, feeling integrated, the sense of belonging in the organization or the school. We think about relationships between peers, between staff member, between the youth and the staff themselves. And then built environment is really about the buildings, the grounds, the recreational aspect. Is there like toys to play, balls to play sports? Is there materials to do arts? Even the way from a youth home to the school or to the organization, is that safe? Is that a place that is easy to access or not? So the social and built environment is really key again, because if you're not feeling safe, if you don't have that environment that is making you safe in general, physically and mentally, how can you be learning? How can you be taking in this new knowledge? And then finally, we have the partnership and services, which are really all the interaction between organizations, a school and other community programs, even between the school and the families. Youth families is important here as well. And how can we leverage these relationship to do more, to be better together? So really being like an elder circle, a counselor service, school nurse, other organization with who we can partner to create recreational activities. So think about all your network, all the resources available in your community, and how we can leverage that. So to see how they interact together, I'm going to give an example of the COVID-19, and you will see how important it is to think about them all together. So when COVID-19 hit, new policy, everything is closed, we have to go back home. Here we have a change in the policy aspect. Government saying shut down and we go home and we stay home. So we have to do schooling home. So then teacher had to adapt all their curriculum, all their classes, courses to the online teaching, the virtual school. So here the shift in policies created or forced a shift in the teaching and learning. We had to adapt. However, not all students had a social and built environment that was safe or that was making the space or helping that learning and teaching. So a teacher could have the best curriculum for virtual learning if at home youth have in the background parents fighting or noise, or they don't have a good internet? How can we deliver this learning and teaching? And so hopefully, in some cases, we were able to partner to to provide devices, to provide internet, to partner with parents to try and create that space where learning can happen at home. So obviously here probably partnership played a role to facilitate all of that, but was not necessarily easy. But we still see how one shift in one of these aspects may shift the whole dynamic, the whole thing, and forced to adapt. So it's the same thing when we think about substance use strategies. So, you know, having policies may be key to make sure that something is happening in your school. However, if we're not teaching and learning, if we're not incorporating it in our teaching and learning, it might never happen. And then if the social and built environment is not safe, then we can have the best teaching, the best curriculum about substance use and their potential harms. We might never be able to deliver it. And so how can we also partner with other services to make sure that this happens? If we don't have the resource in our school or in our community organization to deliver a good information about substance use, can we go have an addiction counselor coming in and helping us with that? So really, this framework helps to guide and strengthen effort while not being prescriptive, and to adjust their plans with as context and need change. So as I showed with this example, we can really adapt, and it's not like you have to do A, B, and C, and all your problem will be solved. It's really trying to figure out how you can adapt to your specific context. And finally, it helps to think through how to translate conceptual approaches into practical and concrete school-based action and identify the assets and gaps within the school community.